May I ask another speaker, Professor Neil BRESSLER? I think he's in the Zoom. He's going to talk about vitamin supplements for geographic atrophy or RP. Please, Neil.
I think we have a recorded talk.
Yeah, it's.
Yeah, can you
play it?
Get Dr.
Yeah, maybe just play video first, and he may answer the question himself later on.
Hello, everyone. I'm Neil BRESSLER, and I look forward to presenting to you our thoughts on vitamin supplements for two major causes of vision loss for which we have little, if any, treatments at this time: geographic atrophy and retinitis pigmentosa. These are my financial and other disclosures. We first considered dietary supplements, such as those used in the age-related eye disease study, or AREDS, based on the original AREDS randomized clinical trial, where participants either received placebo, antioxidants, zinc, or a combination of antioxidants and zinc. These dietary supplements were shown to reduce the risk of eyes that had large drusen from progressing to choroidal neovascularization. But most importantly, there's no evidence that these dietary supplements reduce the risk of developing geographic atrophy, or in those eyes that had geographic atrophy, there's no evidence that they reduce the risk of further growth of that GA. This shows you the major outcome from the age-related eye disease study, where 28% of the eyes at 5 years assigned to placebo compared with 20% of the eyes assigned to a combination of antioxidants and zinc progressed to advanced AMD. Advanced AMD was either choroidal neovascularization or geographic atrophy, and this was shown in a subgroup of those participating in AREDS, those that had AMD categories 3 and 4. Category 3 was large drusen, and category 4 was having the advanced stage, either geographic atrophy or the neovascular form of macular degeneration in one eye, so that the other eye was at risk. But if we break down this information to see if these dietary supplements were protective on the left side or harmful on the right side, the odds ratios show that if you had geographic atrophy developing in the center over time, there was no difference whether you were assigned to antioxidants, zinc, antioxidants plus zinc in comparison with a placebo. And if you look at eyes that had developed any moderate GA, that is 360 microns or more in its greatest linear dimension, again, there's no evidence compared with placebo that any of these dietary supplements were protective. Regardless, people still lost a lot of vision, and it was worse if you had the advanced stage in one eye shown all the way to the right, or if you had numerous large drusen in both eyes or a large drusen in just one eye. Either way, you had an increased chance of getting central geographic atrophy, but it was no different whether you were assigned to placebo or the active treatment of antioxidants plus zinc, or zinc alone. So there's no signal that these supplements have any effect on developing geographic atrophy or having that geographic atrophy progress. What about AREDS2? Well, again, no evidence that when you look at lutein zeaxanthine, which was a new supplement tried in AREDS2, that it had any protective effect for central geographic atrophy, even when you adjust for multiple comparisons. And there were exploratory analyses looking at what happens if you use lutein zeaxanthine in place of beta-carotene. Again, there's benefit of taking these dietary supplements to reduce the risk of getting the advanced stage of macular degeneration when defined as either the neovascular form or central geographic atrophy. But if you break out those two components of that combination endpoint, the dietary supplements only were shown to reduce the risk of developing the neovascular form of macular degeneration and not the development of geographic atrophy in the center of the macula. Again, even when adjusting for multiple comparisons. But what about this publication that just came out at the beginning of 2025, where some of the investigators at the National Eye Institute reported that the oral antioxidants and lutein zeaxanthin supplements might slow geographic atrophy progression? I emphasize the word might, into the fovea in participants that had AMD. This was a post hoc analysis, which means there were numerous analyses done over a decade. And this is the first time any of those analyses showed the potential that these dietary supplements might slow geographic atrophy progression to the fovea. When this is inconsistent with all other analyses that showed no benefit, we don't throw away the results, but we look at them as hypothesis generating rather than guiding clinical practice. They looked at just 208 eyes among the several thousand that were in AREDS2. And they showed only one outcome, what they called proximity-based progression towards the center of the macula. That means there was no GA in the center, and only looking at that progression towards the center was there a reduction of 50 microns per year, giving these dietary supplements. There were only about 50 people in each group of the thousands that were analyzed. So whenever you start breaking down thousands of participants into small groups of 50 or 60, you might find a group that just by chance alone has a benefit. There was no benefit shown for the zinc groups, and it was only for what was called this proximity-based progression towards central macula. In AREDS and AREDS2, with many more eyes that had any geographic atrophy, this area-based progression was not different from randomization to antioxidants versus none alone. In other words, only this very specific group of 50 in each group. And so the conclusion is dietary supplements may reduce the risk of progression to choroidal neovascularization, but only choroidal neovascularization. There's no evidence that they reduce the risk of development or growth of geographic atrophy. So we give them to participants and patients that have geographic atrophy to try to reduce their risk of getting the neovascular or wet form. But the patient and the physician should not believe this is having any effect on the geographic atrophy. Now, what about using vitamin A or this supplement for retinitis pigmentosa? This got a lot of publicity in June of 1993 when Elliot Burson at the Massachusetts Eye and Ear Infirmary reported the results of a trial of vitamin A and vitamin E supplementation for retinitis pigmentosa. The results showed only vitamin A might have an effect on the cone electroretinogram, but no other outcome. And you don't want this to happen, but in this case, the Data Safety Monitoring Committee wrote a letter saying they totally disagree with the conclusions that there's any benefit to vitamin A. They point out that there were a lot of analyses that they saw that weren't shared in the publication that they believe weaken the argument that there's any benefit to vitamin A. And I strongly recommend you read all these letters to the editor that went back and forth because it so rarely happens. This vitamin A supplement, again, might have retarded the loss of some ERG amplitude, but Bob Massoff and Dan Finkelstein pointed out it really is inconsistent with what was seen. There was no vision function benefit. It had no effect on visual acuity or visual fields. And as I said, it's rare that a Data Safety Monitoring Committee actually writes letters to go at odds with the study chair of a randomized trial. This was again seen when lutein was looked at for RP. And again, no vision benefit. And it wasn't the primary outcome, it was a secondary outcome. And when the primary outcome doesn't work, looking at secondary outcomes should be hypothesis generating not concluding that it's beneficial. And an editorial again said the evidence is weak to suggest that this may have a benefit. And finally, when last year investigators from Massachusetts Eye and Ear Infirmary were looking at genotypes to see how this might affect this ERG biomarker from this trial, were unable to duplicate the outcomes of showing a benefit of vitamin A. No evidence of any vision benefits, and the limitations by the Data Monitoring Committee warrant caution to conclude that vitamin A is of any benefit. There's no subsequent evidence that it's of benefit, and the reanalysis failed to show that it was any benefit. And of course, vitamin A has toxicities. In conclusion, despite the ease of accessing vitamin A around the world, and despite the potentially devastating effects of geographic atrophy from macular degeneration, or the devastating effects from retinitis pigmentosa, the evidence I've shared with you should convince you that vitamin supplementation for either of these retinal diseases may not be warranted at this time, and this is even more important to recognize because of the potential toxicities from very high doses of vitamin A. I want to thank all of my colleagues in India and all part of the Asia Pacific Academy of Ophthalmology for letting me share this with you, and I'm sorry I couldn't be there with you in person, but I look forward to joining you in person.
So we'd like to place on record our appreciation and, thanks to Dr. BRESSLER for, providing this talk.